For an athlete, a VO2 max test can provide good information about how their training is going. I want to take a few minutes though to explain why someone who is not an athlete or training for performance might find a VO2 max test helpful and why we even have it here at the clinic. We brought the VO2 max test here to the clinic because research shows that cardiovascular fitness is one of the most important factors for longevity. At GoodMed, we're not just aiming to be a facility that keeps people from being sick, but also help guide folks towards finding better or optimal health. When we thought about what aspects of health have high impacts to longevity and day-to-day function, cardiorespiratory fitness is at the top of the list. When you hear the words cardiorespiratory fitness, you may immediately think of suffering. The good news is that much of the benefits of exercise as it pertains to cardiorespiratory fitness comes when an individual goes from not exercising at all to just doing some exercise. That small incremental step from nothing to something provides a lot of the benefit. So we want to encourage folks to not get discouraged from exercising at all because they don't have the time, ability, or desire to perform optimal exercise. In the case of exercise, some is much, much better than none. So what is VO2 max? What are we actually measuring? VO2 max is the maximum amount of oxygen that your muscles can utilize during exercise. Specifically, it's the maximum volume of oxygen that can be used by your muscles per minute, typically measured in units of liters per kilogram per minute. Where VO2 max testing comes into the conversation is around defining and demonstrating exercise intensity. In fact, the intensity that gives the most cardiorespiratory benefit is surprisingly not that intense. It's fairly easy. You may have heard of exercise discussed in zones of intensity. If we're to think of zone 1 as being very easy effort and zone 5 being maximum effort, zone 2 is on the easier end of the spectrum. For most people, that registers from a heart rate somewhere in the mid-90s up to 120 or 130. You should still be able to converse while you're exercising at this level. There are a few reasons why VO2 max testing can be helpful for a non-athlete. One issue that can come about with someone who isn't training to participate in a race or some other event is that when you're exercising, it can often feel like you're exercising without knowing if you're doing it right or gaining improvement. Doing a series of VO2 max tests, or at least a baseline and then a follow-up, can help provide some guidance and help us frame a goal over a particular time period. Maybe in 3 months or 6 months, you return to repeat the VO2 max test to see what kind of gains were realized from the exercise. What's cool about zone 2 is that it doesn't feel that intense, and I think for most people, it would feel surprisingly easy. That's one big upside to that intensity of training. The second upside is that because it's fairly low intensity, it allows for an individual to exercise for longer durations. The research suggests in order to really maximize the benefit, an individual should be working up to 45 minutes to an hour of zone 2 training 3 times a week. At that frequency and duration of zone 2 exercise, you can maximize the benefits to the muscle and cardiovascular system that will provide maximum benefit towards longevity and overall wellness. Let's talk about VO2 max a bit more. There are kind of 2 ways that you can think about VO2 max, or 2 ways to increase VO2 max. Let me draw it out for you and I can explain it a little bit better. When we're looking at VO2 max, one way you can think about it is like a triangle. With the peak being the VO2 max. And the goal for longevity reasons is to increase the peak. And there are 2 ways you can do this. One way is the zone 2 way. And the idea is that, with zone 2, you're increasing your fitness base. And that would be kind of in this area. So what you're trying to do by using zone 2 to increase your VO2 max is you're trying to make your base wider, right? So if you increase the width of the triangle, it's going to increase the peak. And so your new VO2 max, because of your baseline fitness is now increased, will increase your VO2 max. The other route is by doing intensity training. So imagine if you took your starting off triangle. Imagine that those two starting triangles are the same. And this would be intensity. If you have your base starting triangle and you're not necessarily thinking about going wider, you can raise your VO2 max by going up. And the way that you're going to do that is by adding intensity to your workouts. And this is where kind of intensity comes in to play when we're thinking about VO2 max. And the way that that intensity works on VO2 max is that you're essentially drawing sort of the peak. That intensity is drawing the peak of that triangle upward through things like high intensity interval training. So you can think of HIIT training, it's like CrossFit, where a lot of the elements are sort of the circuit training where you're doing these high intensity intervals and kind of stacking them up back to back. The duration of the workout may not be, you know, much beyond 20 minutes or so, but within there you're hitting sort of this max effort repeatedly. So those are kind of the two approaches to increasing VO2 max. One is through zone 2 by increasing the base of the triangle. The other way to increase VO2 max is by trying to draw up the top of that peak of that triangle without increasing that base. If you want to maximize benefits of all of it, you would do both. You know, so you would add those two together, and you'd be aiming for about, you know, 80 to 90% of your time in the zone 2 kind of training intensity, and then kind of leaving the last kind of 10 to 20% for this interval type training. And the combination of the two will likely give you the maximum benefit to your VO2 max. But that said, if you don't have interest in going this route, you'll still get a lot of benefit from spending a fair amount of time in this zone 2. And remember that zone 2 is conversational. So if you wanted to think about it as effort, it would be in the 3 to 4 out of 10 range, thinking of 10 as being max intensity. Your heart rate is going to be approximately 60% of your max heart rate while you're in zone 2. Your breathing is going to be increased, but you're not going to be out of breath. You're still going to be able to hold a conversation. So when you're trying to figure out kind of where you are around zone 2, you can use the perception of intensity, how intense it feels, as one gauge. You can check in with your heart rate as another, and then how quickly you're breathing. So between those three, you can kind of keep yourself in that zone 2. So just a reminder, a couple of key points with zone 2 is that duration matters. So to maximize the benefits of zone 2, you try to work up to 45 to 60 minutes per session. And doing that 3 times per week. And then the other thing is that it needs to be steady. So unlike interval training or high intensity, this is definitely on the lower side of effort level, but it needs to be sustained effort. So on the high intensity side, you're looking at sort of a 8 to 10 out of 10 range as far as effort goes. And these intervals, though, are going to be much shorter than the time that you spend in zone 2. So it could be as short as 30 seconds per interval, and but up to kind of 4 to 5 minutes, kind of at the longer end of how long those intervals are going to be. But let's go take a look at the equipment that we use for VO2 max testing, and I'll go and review that with you real quick. Okay, let's take a few minutes to discuss the equipment that's involved in having a VO2 max test and the resting metabolic exam. So this is the cycle that we use for the VO2 max testing. It may look like kind of this old dinosaur of an exercise bike, but it's actually designed specifically for testing like this. What it allows for me to do is fairly precisely adjust the resistance in set increments so that the test is repeatable. And it also makes during the test, it makes setting the resistance in very consistent intervals, so that the jumps in resistance aren't too high. The goal of the testing is to take somebody through sort of progressive resistance over a fairly short time period. So it's about 10 minutes long, the testing, and starts very, very easy, and then just kind of slowly over the course of the test gets incrementally harder. When someone first comes in, the first thing that we do is get them set on the bike. This bike's adjustable, the seat height and the handlebar height adjusts, and so we can get that set up for the patient's comfort. And then we get a heart rate monitor placed on the patient and make sure that it's connected to the computer here. And then we get the individual fit with the mask. So this is the mask that the test subject wears, and this allows for room air to come in, and all of the exhaled air gets connected via this tube here through the exit port. So it travels from the mask that the individual is wearing and plugs into the analyzer machine. So this machine here measures the amount of CO2 that the individual's exhaling over the course of the test. And it's connected to the computer here, which gives a readout in real time as we're going through that. Once the individual is set on the bike with the mask, it's connected here, the heart rate monitor's on the patient, and connected also to the machine, then we hit go on the test equipment. Test takes about 10 minutes to complete, 10 to 15, depending on the individual. And while the individual is pedaling on the bicycle, I'm watching the computer readout and sort of explaining things as things go, and checking in on the person doing the test. And every minute I adjust the resistance on the bike, and the test just progresses that way until the individual is no longer able to keep up with the resistance and maintain a consistent RPM as far as the pedaling cadence. So the only job of the person doing the test is to look down at this little screen here, this little readout, and make sure that they're maintaining a consistent RPM. And so when you take the RPM, the speed that the pedals are moving times the resistance, and that gives the power that the patient is putting out. That's essentially it. So when the test is done, we remove the mask. There's a 2-minute, so actually before the mask comes off, there's a 2-minute cool down period where we continue to measure heart rate and measure CO2, and that gives sort of the last portion of the graph or the assessment, and sees how well the individual recovers from that max effort. That's essentially it. So it's a pretty quick test. There is the option when you're doing the test to stop before you get to that maximum amount of effort. The most accurate way to do the test is to take it all the way to max effort, but there's the option to stop a little bit early, and I usually point that out to the patient while they're doing the test, and I say, hey, if you want to stop at this point, I think we have enough data, and the program will essentially estimate what that VO2max would have been had they gone all the way to the end of the test. I always instruct patients to let me know if they're experiencing any pain or discomfort, and they always have the ability to stop the test at any point. They can just stop pedaling, essentially. The other test that we do here is the resting metabolic rate test, and that one's definitely much simpler. We typically, I have the individual laying on a massage table, and using the same analyzer, we use a slightly different equipment setup. It's much simpler. There's no headgear that you have to wear. There's no mask that goes over the nose, but you essentially just place this tube with the mouthpiece in your mouth, and all of the exhaled air just comes through this tubing into the machine. And I think the worst part of the resting metabolic rate test is having to wear this nose clip. This keeps individuals from exhaling out of their nose. But that's it. So the resting metabolic test takes about 10 to 15 minutes as well. This test is about 10 to 15 minutes. We typically budget about an hour and 15 minutes to run through both of those tests. But yeah, it's pretty simple, pretty straightforward. If you're interested in having the VO2max test done, it is free for GoodMed members. It's just part of membership. We're trying to encourage overall fitness and fitness with a longevity type mindset. And the VO2max test, it can be really helpful in helping an individual determine effort levels. So when they are exercising, the amount of effort that they would need to do, or target heart rate that they should have for zone 2 training specifically. That's the way that I tend to use the VO2max test, not necessarily to, you know, track somebody's fitness, but it's helpful to use the VO2max results to help frame an exercise program and an exercise goal. So for folks who aren't trained athletes, aren't competing, and just wanting to exercise for day-to-day wellness and functioning, we're able to actually create a program that actually sets some goals for folks and are able to add a little more refinement to those recommendations using the numbers that come from the VO2max test results. Yeah, so if you want to sign up for VO2max testing, it's free for members, and you can register through the website. There's a metabolic testing visit type. Just go ahead and schedule that at your convenience, and we'll be happy to run you through this test. Reach out if you have any questions. We're always here to help out, and that kind of wraps up the explanation of VO2max testing.